Imagine trying to solve a puzzle where every piece seems to fit somewhere, but the picture never seems to fully come together. For many dealing with chronic illness, this is exactly how it feels. Chronic illnesses like fibromyalgia, many autoimmune diseases, chronic fatigue, and mast cell activation syndrome, or MCAS, have overlapping symptoms and often have a combination of contributing factors. And then there's Lyme and Lyme-like diseases. If you suffer from one or a combination of these, or have some baffling chronic illness, then it is possible or even probable that you could have an underlying mold, MCAS, or tick-borne illness underlying your condition, going unnoticed and creating chaos in your nervous system, stopping you from healing. Because these conditions often overlap, they create a complex web of symptoms that can be really hard to tell where one condition ends and another one begins, and making the symptom picture really complicated, and therefore hard to put into a box. Further, it is rare that any of these issues exist in isolation. Instead, they tend to amplify one another's effects, creating a feedback loop of inflammation, fatigue, and hypersensitivity. Hi, I'm Alexis Wadeland, osteopath, and co-founder of Blossoming Me and Healthy Learning Lounge. Join me as I explore how these conditions connect and the signs to watch out for, and why a holistic, phased approach is essential for recovery. Mold exposure and some tick diseases are often found together, as one will lower your immune system, the other is then able to enter and flourish. Here's how they can then interact. Immune system suppression. Mold toxins weaken your immune defenses, making it harder to fight off infections like tick-borne diseases. Chronic inflammation. Both mold and tick-borne diseases will trigger widespread inflammation, leading to symptoms like joint pain, fatigue, and brain fog. Neurotoxicity. Mycotoxins from mold and toxins from bacteria like Borrelia and Babesia protozoas can cross the blood-brain barrier, causing cognitive and widespread nervous system as well as emotional disruption. This overlap means that with any of these symptoms, testing for mold as well as tick-borne infections could really assist in the effective treatment and healing of patients with such issues, and that for full recovery of chronic and complex conditions, looking into these infections as possible cofactors is necessary. MCAS, or mast cell activation syndrome, occurs when your immune cells, called mast cells, become overactivated and release too much histamine, as well as other inflammatory chemicals. While mast cells play an essential role in fighting infections, their overactivation can cause hypersensitivity and chronic inflammation, as well as nervous system chaos. The key here is that mold, tick-borne infections, and other infections, be it bacterial, viral, fungal, or parasitic, all have the potential to activate or overstimulate mast cells, and each has the potential to trigger or exacerbate each other. When this occurs, a plethora of symptoms may begin. Things like flushing and or rosacea, itching, digestive issues, food and chemical sensitivities, regular illnesses, autoimmune diseases, mood swings, anxiety, depression, intense fatigue, brain fog, and autonomic and vagus nerve dysfunction, resulting in things like POTS, or postural orthostatic tachycardia syndrome, things like nausea, even anorexia, as well as even more. In turn, any of these then creates stress, and if you increase your stress levels, this also exacerbates the symptoms of each of these conditions. So you can see then that the potential for such a negative, frustrating, disheartening, and debilitating cycle is really set up here. One of the most frustrating aspects of mold toxicity, Lyme and similar diseases, and MCAS is how their symptoms do overlap. Common signs might include persistent fatigue and brain fog, chronic pain in the joints, muscles, and nerves, digestive discomfort like bloating or diarrhea, constipation, sensitivities to foods, smells, medications, and emotional symptoms like anxiety, depression, or mood swings. Because these symptoms are so widespread and non-specific, many people are misdiagnosed with conditions like fibromyalgia or chronic fatigue syndrome. Proper diagnosis requires recognizing patterns and triggers unique to mold, Lyme and Lyme-like diseases, and MCAS. Healing from these interconnected conditions is not a one-size-fits-all process. It requires a systematic approach to address each contributing factor. So here's a good place to start. Calm your nervous system. Supporting your nervous system is foundational. When your body feels safe, it is more receptive to healing. Techniques like diaphragmatic breathing, grounding exercises, and gentle exercises such as yoga can really help. Making sure you remove any mold exposure, working with a professional to eliminate mold from your environment, especially your home and workplace, and to support detoxification with things like binders, like activated charcoal, and make sure that's under medical supervision. Addressing any Lyme or Lyme-like conditions. Here you would need to partner with a Lyme literate practitioner to identify any of these bacteria and protozoa and create a treatment plan that may include antibiotics and herbal protocols. Stabilize your mast cells. A low histamine diet combined with natural mast cell stabilizers like quercetin can reduce hypersensitivity and inflammation. Rebuild your gut health with supporting digestion with probiotics, gut healing foods, and enzymes to restore the balance and to strengthen your gut lining. And then tackle any lingering issues, addressing symptoms like fatigue and brain fog with targeted lifestyle changes and supplementation tailored specific to your needs. This layered approach ensures that your body can handle each step without becoming overwhelmed, paving the way for a sustainable recovery. Healing from mold toxicity, tick-borne diseases, and MCAS can feel isolating and overwhelming. Progress may come in waves, it will take time, and setbacks are common. Having the right support from practitioners fluent in such conditions to supportive communities can make all the difference. As I said, recovery does take time, but improvement is possible. With persistence and the right guidance, you can move past the frustration of chronic symptoms and begin to reclaim your health. If you're feeling stuck in a cycle of chronic symptoms, then my new course, Soothe Your Nervous System for Healing, might be just right for you. It offers actionable steps to calm your nervous system and lay a foundation for the ability to recover. When you're ready, we then have a further course to help provide a full roadmap to address your own specific combination of infections and dysfunctions, empowering you to reclaim your health and vitality.
So that's it for today. Did it raise any questions or aha moments? If so, I'd love to hear them, so please put those in the comments section. I love answering questions. I hope you found today useful. And if you know someone who could use this information, please share it. Remember to comment, like, and subscribe. Until next time, and in health, bye for now.